Welcome to the Protecting the Village show, brought to you by the Protecting the Village campaign, presented by T-Coast Communications and Marketing, and funded by the Allegheny Franciscan Ministries. I'm your host, Anthony Maynard, and today we have with us Dr. Ramgopal. Dr. Ramgopal joins us from Midway Specialty Care Centers, right here in the General Fort Pierce, Port St. Lucie area. We're glad to have him. Dr. Ramgopal, thank you for coming on with us.
Well, thank you. It's indeed a pleasure to be here, and I feel very fortunate to be here as well.
Thank you so much. Now, we're going to get right into it. Why don't you tell us a little bit about your origins, where you're originally from, what brought you to this area, and kind of how you got started?
Oh, that's a good question because it takes me back many, many years. So I was actually born in Guyana, South America. And the trick question was, which country is the only English-speaking country in South America? And many people don't realize it's actually Guyana, not Ghana. So I've been born in Guyana in a very tough time in the 60s and the early 70s. Guyana went through terrible economic challenges, and then from Guyana, I was fortunate enough to obtain a scholarship to study medicine. I ended up studying medicine from the Guyana government at the University of the West Indies in Jamaica. I spent 5 really, really good years there, and it taught me a lot. I mean, medicine was not my first choice, but my father had 5 children, and he always wanted one of his children to become a lawyer. He said, I want to be a lawyer, want to be a medical physician, want to be an accountant. And I was the last of 5, so it was left to me because the other 4 chose something else, either law or business or something, so I ended up doing medicine. The challenges of medicine, however, is quite interesting because as a young age, I think it was like 5 or 6, I recall I suffered from horrific headaches and was admitted to the hospital. And I recall I was diagnosed with meningitis. Here I was as a 6-year-old, and I never forgot that story. 10, 15, 14 days I was in the hospital. It was a kind of challenging time. And then years later, I even ended up with dengue. So I think infectious disease ended up calling me instead of me calling for infectious disease. So even after I finished my medical school, my first intention was to go to the United Kingdom because that's where everyone from University of West Indies ends up. Okay. And because our degree is kind of accepted in the UK system. But my mother, I think she had other ideas for me. She said, well, she left Guyana and went to New York and was taking care of kids so that her children could get a better life. Because Guyana in the early 80s we were struggling with poverty. I remember studying with, of course, lamps and gas lamps and things like that, and long lines for food and milk and flour. So growing up in that world of seeing poverty around me and challenges around me, it's something that was really brought out throughout my career and my life, that desire to take care of surroundings or the environment that I was involved in. So when the time came for me to choose my fellowship, I did medicine in Jamaica. I spent a few years in the Bahamas. And in the Bahamas in the early 90s when I really became intrigued about HIV and infectious disease. Why was I intrigued was that here we had about 50 patients in the wards. We call the wards where patients go. And no one wanted to take care of them. And they were young people, and they're just waiting to die. Wow. And I felt, I want to go there. I want to take care of these patients. Yeah. And that's how I became engaged with infectious disease, because I find that, you do something, it's something of value. You can either save someone's life or do the best you can to try to save a life. Right. So even after I finished my residency and I had to make a choice, do I do cardiology, do I do oncology, these are all great subspecialties, but I thought that what's going to help me bring the most satisfaction to me probably in the world of underserved population, economically deprived communities, it's infectious disease. But you just need a stethoscope, you need diagnostics. I can go to Guyana, I can go to Africa, there's malaria, there's TB, there's dengue, there's everything else in the world. Majority of what we face in the world has always been infectious diseases.
Was there a connection to that and you coming to this area?
So when I finished my residency and fellowship at University of Miami, I went back to Guyana for several months, and I recognized that I'm struggling here. I need to come back to the United States. Yeah. So having come back, I was working as a hospitalist in Tampa, and then I was looking for job opportunities. I had a couple of job opportunities at the U.S. Army to work in research or to work in an academic situation. And then I looked at the map of Florida, and I looked at Miami, and I looked at Orlando, and I circled this area. I said, I'm going to go there. I didn't know a single soul in this community.
Wow.
21 years ago, and I jumped in my car. I'm going over St. Lucie. Where's that? I had no idea where St. Lucie was. But I circled, I drove across from Tampa, and I came to the hospital and said, I want to start here. And so I always looked at that as spiritual divine intervention.
Yeah.
Everywhere along my life, I look as there was some spiritual intervention. Like, take for example, when I finished my A-levels in high school, and I said, where am I going to go? Because my brothers are in college. The financial situation back home was very terrible. I needed a scholarship. So here's a scholarship. And then the scholarship said, well, you need to go to Russia. And then I said, I don't really want to go to Russia to do medicine. I prefer to go to, because Guyana is, is a communist country or a socialist country, that affiliation with Russia. And I said, oh no, I hope I can go to Jamaica. So I prayed and prayed, and I got to go to Jamaica. So I've always been a big believer in faith, prayer, spirituality. And throughout my career, I always bring that to my patient's bedside, even though I know that this is something that people don't like to talk about. I sit for my prayer, patients, and I hold their hands, and sometimes, we communicate that way because there's a spiritual power there that brings us there.
You find that as a doctor, in terms of your perspective there in association or in regards to maybe some of your colleagues, is that, because I hear sometimes that can be a struggle of will, struggle of philosophy in terms of being a medical doctor and dealing with spirituality and religion. Can you speak on that a little bit?
So it's not a struggle for me.
No.
It's not a struggle. I've been in the path, I've seen it, I've prayed, I've been, in my opinion, I've been under the guidance of that spiritual power. So it's very easy for me. I respect the religious beliefs of, pretty much everyone. And I trust people, and I trust that spiritual guidance, because I look at my patients who come and sit in front of me, and they're HIV positive, and their whole world is crumbling around them. And how can you give them faith and hope and guidance? And here's medications, yes, but it's more than medications. You have to give them hope and faith. And I think the one thing I ask my patients, do you go to church? Do you pray? Do you challenge yourself? And I find that every time I bring that conversation up, it opens up a new conversation with patients.
Yeah.
And it's a very enjoyable conversation. And I've never ever have a challenge in my career where I've brought up spirituality or religion and God into a communication and I've been rejected. I haven't seen it yet.
Have you found yourself doing more of that sort of conversation since the pandemic started?
Yes and no, because, well, it started with HIV. I think I've learned the process with the HIV epidemic. And with the HIV epidemic, so this kind of flowed over. This is a continuation of that story in my eyes. What I have seen, though, is with patients laying in bed is fear. And I have to bring that story in. Like up to yesterday, I saw a patient, and I looked at them and said, don't be afraid. We are here for you. And that, because the first thing a patient with COVID has, they cough, the shortness of breath, and they're in the hospital now, and they hear all the stories out there that you're going to die, you can get sick, you can be intubated, and the processes. And I think it's such an important point to point out to them, no, let's do this, let's be strong, let's have strength and faith. And I think as much as you can give medications, I've always seen, so my question sometimes be, I can give two patients the same medications, one will live, one will die. And some of you always ask that question, why? Why did this one live and why did this one die? And so that's why I'm a strong believer in that faith consciousness, understanding that here's medicine, here are medical care and treatment and everything we do, but there's something else sometimes that we can't explain. And that's what I explain as faith or spirituality or bringing that religious concept into our care. But I've enjoyed taking care of patients afflicted with terminal diseases or potentially terminal diseases and wrapping ourselves around this sense that, hey, we need to believe in God. We need to believe in the world around us. We need to believe in that spirituality.
Important.
It's very important.
Important.
And it helps me to get through to the days, like I was explaining to my brother recently. In the 30 years I've been taking care as a physician now, I've been probably a physician over 30 years now, and I've probably seen more death and dying than most physicians. I saw the death and dying in the 90s with HIV, and I've seen it now. And I mean, I look at the patients, and sometimes I sit with them and I think about their lives, what it was like for the last 50, 60, 70 years. And as you sit with them, you kind of like, this is a tough story. And as a physician now, you have to get strength in something. You hear more and more about physician burnout, and you hear about physicians struggling, and I do believe going back to that faith consciousness is what has guided me over the years and kept me strong.
Now, is that part of your motivation? Because I understand you were really pivotal and instrumental in the work that Pastor Kenny did in bringing the vaccine into Lincoln Park. Can you talk a little bit about your involvement there? You're modest in your presentation on I understand the spirituality side of it, but there's also the good of man involved, and I think that's a situation that we want to highlight because most people don't know about that.
Yeah, thank you for that question. So when do you think back about why did I come to Fort Pierce and why did I stay in Fort Pierce? So when I came here 21 years ago, my initial intention was, okay, I'll spend a few years and then go back to academia, understand what the culture is, but then Fort Pierce sucked me in.
Yeah.
It pulled me in. The patients pulled me in. The Haitian patients, Jamaicans, West Indian patients, American patients, poor patients, children in their 15 and 18 with HIV and in their 20s and 30s, and substance abuse, and it really, I think back of how the challenges people in Fort Pierce face, and I always describe Fort Pierce when I give lectures wherever I go as an inner city without a big city, and I feel so proud that we were able to bring down the HIV story. The HIV incidence in Fort Pierce, St. Louis County has dropped. We were the highest in the state of Florida at one time. Now we're down to number 15 or 16 counties in the list of counties. We've moved from over 350 new diagnoses a year to less than 50 cases now. And you look at and everyone liked to blame poor communities for what they're in, and I felt that this is an important story. And as Midway Clinic was set up in Fort Pierce and Midway Road, and we started this nonprofit, and we've been reaching out to communities. We have food, we provide food services, we provide vouchers. You know how many of my patients can't have transportation to come to my clinic? I'd ask them, so why did you miss your last 2 or 3 appointments? And immediately I know it's either depression, it's either a transportation issue, or something else. So when Pastor McKinney said, can you cut 1 second? What's his last name again? I'm going to mispronounce it.
Pastor, so it's Pastor Kenneth Mills.
Kenneth Mills. So we were doing a presentation at the health department, at the county, and Pastor Mills stood up and said, what about Lincoln Park? And I kind of crumbled. I said, you're right. What about Lincoln Park? Because the health department started to say, well, Midway, you can probably do vaccines, you can help us, you have a clinic of a lot of patients, we have an organizational skill set which we can actually provide, we have storage facilities, we have a research site, can you help the community with vaccines? I said, yes, let's jump on it. So a lot of my employees donated the time and the effort. So when Pastor Mills stood up and said, Lincoln Park, I said, wow. You're so right, because we're so engaged in how do you get a vaccine. If you're over 65, you get your name down, you put your name, we had a website list, and we put patients' name down. They enter their name and stuff, and they drive up. And I said, but Lincoln Park, they don't have cell phones. They don't have internet capability to put their name down. They don't have a car to drive up and come and get a vaccine. And then we when we were given back, we didn't think about it. He just said out of bulb, wow, Pastor, you're so right. And when we look at how many vaccines were given at that time, and how many were given to groups that were not able to get there, it was sad. And I said, no, we got to jump on this. We got to take care of this right now. So my staff volunteered. Let's go to the church. Let's get this done. And I think this is my strong belief in communication, commitment. He really engaged us, and now we've done, like today, we did over 90 more vaccines at the cricket club, and we know the group of the challenging groups we have. So I think, when a lot of the elderly patients who were coming in wheelchairs and 6, 7, and 80, and we give them vaccines, that was such an amazing feeling, to know that you can actually go to places where they kind of come to, when they kind of come to us.
Well, Dr. Ramgopal, we thank you for your help, your benevolence in doing that and offering that. It's been definitely a difference maker in the community. Before I let you go, there's a question I had for you, because you and I both share an island heritage. It's a unique thing. It's a thing that those who have it take a certain pride in. And I wanted you to talk a little bit about that from the medical perspective. Obviously, you've gotten to a certain point, very accomplished, doing great things. Where does that island heritage play a role? Any motivation? Anything else drawn from that? Can you share a little bit about that?
So what's the island heritage? The island heritage is an incredible story. So I go in the hospital, I will tell everyone hi, hello, good morning, how are you? That's the island heritage. The island heritage is say, how can I help? When can I help? What can I do? That's the island heritage. The heritage we get from our parents, from our families, from living in Jamaica, living in the Bahamas. It's a culture. And I think I was so happy that when I came to Fort Pierce in Lucy County, I found that culture. So instead of going back to Guyana to find it, I found it here. So even though I've now recently opened a clinic back home in Guyana because I want to provide services for people there as well, I felt so much, this is also my home. I had so many Jamaican friends, Bahamians. So the island culture is a warm culture. It's a kind culture, it's a friendly culture, it's a benevolent culture. It's a culture of giving. They will give you any and everything they can. And I think that's why when anyone asks me, can you do this for me? Sure. My question is not if I can do it, is how can I do it and when can I do it and how can I get resources to do it? And I think that's the island culture.
Thank you so much for that. Thank you for sharing that. This has been Dr. Ramgopal, and all the information and the background that he shared. We thank him so much. We thank him for his contributions in Lincoln Park. This has been the Protecting the Village show. Check us out on LincolnParkGuide.com, where all of these videos and interviews that we do will be posted. Check us out on Lincoln Park TV. Thanks again for joining us, and we will see you again next time.